Hi, my name is Jennifer Ramirez, and I am here to talk about my reflection on my practicum experience, the development of my capstone project, and my personal and professional growth over the course of my RN to BSN program. So part one is where we discussed the intervention with the patient. I met with the patient for 3 hours at the patient's home, discussing the problem of hypertension management and the different interventions that I was proposing. Why was this a problem for the patient? The patient needed more accountability to manage the hypertension independently at home. The patient would have various excuses that prevented the patient from getting the care that they needed, like, I don't have time to get to the doctor, I don't have the resources to get to the doctor, I can't pay for transportation to get to the doctor, or I forget to take the medication and I forget to monitor my blood pressure. The patient also had some questions about blood pressure management and further clarification that was needed from the healthcare provider, but would frequently miss appointments that were scheduled in person. All of these barriers to care added up to the patient not being able to manage hypertension at home independently. This is a problem due to mismanagement of hypertension, can lead to serious traumatic events like heart attack, stroke, or even death. What was your intervention? My proposed intervention was to incorporate more technology-based healthcare into the patient's care plan to connect the areas the patient was having difficulty managing with the healthcare provider. The patient was very technologically savvy and had access to all types of electronic communication devices as well as internet access. Some technology-based ideas that were implemented were telehealth visits with the healthcare provider over virtual electronic device rather than in person. The other intervention that was utilized well by the patient was applying the technology apps for health and monitoring the progress of blood pressure management and hypertension management. How will the patient apply the intervention? The patient was able to adapt to these interventions very well and did utilize the blood pressure app, which had alarms programmed by the patient to remind the patient to take the blood pressure and to take the medications. The patient also used the app to share with the healthcare providers so they could track the progress. The patient also utilized the Calm app to start decreasing outside factors of stress in the patient's life. The patient even went on their own to add an app that focused on improving exercise, diet, and would improve the management of blood pressure over a period of time. The app provided meal logging with detailed food nutrition facts about what the patient was eating. The app also had different recipes that you could try. The app monitored water intake. It also had an exercise section that showed how much exercise the patient was getting per day, the messages to remind the patient to get active throughout the day to meet their goal. The patient also has been using telehealth appointments, and the appointment attendance has improved. How often will the intervention be used, and under what circumstances? The interventions that the patient is using are being done daily as well as biweekly for now. Daily interventions include the patient logging that he took the blood pressure medication, logged the blood pressure reading, and used a Calm audio for at least 10 minutes of meditation daily. The patient is also logging meals, water intake, and exercise daily. The meetings with the healthcare provider were changed to biweekly due to the patient not being able to manage at home independently. However, we changed those meetings to telehealth visits due to the lack of attendance. The patient reports that this will be much easier, and transportation or not wanting to go to the doctor's office will no longer prevent the patient from getting to the visit. Telehealth visits with a provider are now biweekly. If the patient can be compliant with the telehealth visits and the monitoring of hypertension, then the visits will decrease monthly to monthly telehealth visits. The home health nurse will also decrease to monthly instead of weekly if the patient can be compliant with these interventions. How easy was it for the patient to use the intervention? The patient was very tech savvy, and so incorporating these interventions was not very hard for this patient. The patient even linked their Apple Watch to the family members in order to make it more competitive for them to make the daily exercise goal more fun and challenging for the patient. Describe any challenges associated with the patient, family, or group's use of the intervention. The only challenge I foresee with the patient is the motivation to maintain this plan and stick to the interventions for hypertension management in the long term. So this will be the biggest challenge for the patient. So the support system is going to be the main factor here. It really is going to have to be a strong support system. He's going to have to be supported by everyone on the team. So from everybody from the healthcare provider to the at-home nurse, as well as the family, and even just having that internal motivation is going to have to, maintain in the long term. Were instructions necessary? Some minimal instructions were necessary just in order to set up the telehealth visits. The insurance had to be reviewed to see if the patient qualified for the service. Getting that set up with the patient at home took a little bit of collaboration and figuring out the communication method with the healthcare providers, who also provided some instruction. Also, some minor instruction on what to look for in the apps to help manage the hypertension was provided. The provider's office also had some instruction on preference for data communication between the patient and the provider's office regarding the blood pressure readings. What did the patient say about using this intervention? When the intervention was introduced to the patient and the family, they were very open and receptive to the new ideas. The patient really liked the ideas to incorporate more technology into the healthcare plan for the patient at home. Since the patient used these devices frequently and daily, the patient was much more open than I thought they were going to be. Was the intervention helpful? I saw immediate results from the interventions as I advised. The patient immediately downloaded the blood pressure app and took his blood pressure and logged it right in front of me during the meeting. I was surprised at how eager the patient was to start the plan. Then the patient started getting his table set up for where he was going to meet with the doctor on a biweekly basis with his tablet that he was setting up on the table. The patient actually seemed genuinely excited for this process and was putting personal items around the area, like he was decorating it to make it feel more comfortable. During the COVID pandemic, telehealth visits decreased the no-show rate of 7.5% compared to before COVID pandemic no-show rate of 29.8%, as well as satisfaction rate of in-person visit versus telehealth visit had no difference. Dreerup et al. 2021. That is a 22.3% improvement in compliance with no-show to appointments with the doctor. So there's just a little bit of evidence that shows that the telehealth visits do improve the no-show rate, which was one of the barriers to this patient getting health care provided. How will the patient continue to use the intervention? The patient and the family are going to continue to use the telehealth visits biweekly until it can be reduced. The technology apps to measure the healthcare parameters in order to manage the blood pressure, the different elements, the internal and external factors for management of blood pressure will be continued on the smart devices and until the foreseeable future for the patient. So it seems like they're pretty interested in using those interventions and continuing to use them in the future. Explain how the intervention positively or negatively affected the patient, family, or group's life. The interventions have positively affected the patient and family. There were no negatives that the patient or family could think of with the new interventions that had been proposed. How can the effect be measured? The effect could be measured by how many telehealth visits the patient is compliant with and attends. Also, the logging of the blood pressure, medication compliance, and external factors like exercise, diet, and stress reduction could all be measured for compliance. The blood pressure measurements would also indicate if these interventions have been effective. After a period of time, the blood pressure should be at a more managed level, and